Hello, dear friends and colleague. Uh, Now, I'd like to talk about another topic, which is not a big topic, very small topic, but you will get this case in your word, in your daily practice, and in the exam. It is very common in exam, and also you will get in your word and practical life. It is a pseudomembranous colitis. Pseudomembranous colitis basically is an inflammation of the colon uh, due to use of antibiotic, usually broad spectrum antibiotic. Uh, this pseudomembranous colitis usually caused by Clostridium difficile. If you analyze the colitis or pseudomembranous colitis, this is in the name there is informations about pseudomembranous colitis. That means there is inflammation of the colon, and there will be pseudomembrane. So when any person will get some sort of antibiotic, especially clindamycin, cephalosporin, ampicillin, amoxicillin, clindamycin more notorious, he will develop diarrhea. Diarrhea may be watery or bloody diarrhea. So after using these, the Clostridium difficile in a colon can cause inflammation. This inflammation can cause ulcer and some creamy white membrane, that is pseudomembrane, in the colon. So as it is inflammation, the patient will have symptoms of abdominal pain, and there will be ulcer. For that reason, patient will get um, bloody diarrhea. Sometimes during taking this antibiotic, patient may develop diarrhea. Maybe it is watery also, but in some cases after 6 weeks of taking this antibiotic, patient may develop diarrhea. So just remember it, that after taking clindamycin or cephalosporin or ampicillin or amoxicillin, patient may develop watery or bloody diarrhea. So diarrhea will diarrhea will be watery or bloody, and it will cause dehydration. So the complication of dehydration also can be there. So main cause, the causative organism is Clostridium difficile, and it is due to antibiotic use, mostly clindamycin, but other broad spectrum antibiotic can also cause, like cephalosporin, amoxicillin, ampicillin, amoxicillin plus clavulanic acid. This type of antibiotic can cause, if it is a long period of time, can cause pseudomembranous colitis. This Clostridium difficile can be present in healthy person also. In case of young, 4%, and in case of old, 20%. So it is common in older people more than 65 years of age. 80% cases, the older people who are taking antibiotic for any other causes, like treatment of the pneumonia or treatment of other bacterial infection where this antibiotic is used, this patient may develop this type of diarrhea, abdominal pain, bloody diarrhea. It may be similar to ulcerative colitis. So your DD will be ulcerative colitis, but just take history whether he had taken any broad spectrum antibiotic, especially clindamycin, or not. Okay, so how will diagnose? So taking history and symptoms, abdominal pain, watery diarrhea, after taking antibiotic, you just go for investigation. Investigation, this type of colitis caused by toxin A, that is enterotoxin, and toxin B is cytotoxin. It is from Clostridium difficile. So how will detect this toxin? By ELISA test, you can detect uh, toxin A or toxin B from the stool. Number one. Number two, you need to culture and sensitivity or stool for RE for diagnose other cause, and also culture sensitivity to see the growth of Clostridium difficile. Another thing, colonoscopy. By colonoscopy, you will see there is ulcer, erythematous, um, some creamy white membrane adherent to the mucosa. So we will get this type of thing. So colonoscopy, another type of investigation. You will do other test for renal function test, to blood urea, to see whether there is any uremia or not because of the dehydration, any acute kidney injury or not. So to exclude the dehydration complications, you have to do some other test. Treatment is uh, first treatment, stop the culprit, that is the causing antibiotic, that causative antibiotic, just stop this antibiotic. Second thing is start metronidazole, oral metronidazole, or oral vancomycin. Just remember it, in exam they will say intravenous vancomycin treatment for Clostridium difficile, that means pseudomembranous colitis. No, my dear friend, it is oral vancomycin, not intravenous. Intravenous vancomycin is for methicillin resistant staphylococcus aureus infection or some endocarditis due to staphylococcus, uh, but not for pseudomembranous colitis, not for Clostridium difficile. So in question, that in exam they will say that the treatment of choice of pseudomembranous colitis is intravenous vancomycin. It is wrong. It is oral vancomycin. So they can give intravenous vancomycin, they can give metronidazole. In that case, your answer will be metronidazole because it is oral, not intravenous. Okay. Then rehydration. There will be dehydration, so just correction of the dehydration, the IV fluid. Then if not response, in some cases IV immunoglobulin is necessary. Is it serious infection? Yes, it is serious, because if you don't treat this pseudomembranous colitis, patient will develop renal failure because of dehydration and toxic megacolon, which can lead to ruptures or perforations of the colon, and this will be very hazardous for the patient. Okay, so patient may develop perforation and toxic megacolon due to pseudomembranous colitis. So you need to treat this patient seriously. So in exam, if any patient, old age patient, treated with antibiotic, especially when clindamycin, or they will not give this the clue, only they said that this patient had been taken antibiotic for pneumonia or for any other broad spectrum antibiotic, and patient developed diarrhea after 15 days or after 6 weeks, diarrhea is bloody. So old age man, this type of symptoms usually lead to one diagnosis, this is pseudomembranous colitis. So by colonoscopy also, I'd like to add another thing. Biopsy can be done to exclude other disease like ulcerative colitis. Okay. So this is all about pseudomembranous colitis. In exam, it will come IV vancomycin or oral vancomycin, oral metronidazole or not. What are the causative organism? Clostridium difficile. What are the culprit drug? That is clindamycin, ampicillin, amoxicillin, or cephalosporin. Which age group is more affected? That is old age, more than 65 years. Whether this Clostridium difficile present in the stool in healthy person or not? Yes, 4% in the young adult and 20% in the old age. Uh, what are the DD of the pseudomembranous colitis? So, ulcerative colitis. What are the complications? Toxic megacolon and perforation. So remember this thing. You will answer. You will able to answer all the questions related to the pseudomembranous colitis, and in your exam probably will get one question from here. So thank you very much, my dear friend. Just stay with me, subscribe my channel, and I'll be coming with another hot topic for Mrcp and any entrance exam in my next video. Okay, thank you very much.